Across many rural areas in America, access to high-quality, cost-effective medical care for members of its community can be elusive. Many residents are forced to travel long distances for primary, surgical, specialty, emergency, and long-term care, and often choose to forego regular wellness appointments. Medical professionals feel it's essential to level the playing field and give citizens in these areas the health equity they deserve.
Community hospitals play such a vital role in rural America. The demographic of rural community members is a little bit different than their urban counterparts. We are more likely to be elderly. We are more likely to have socioeconomic disadvantages like poverty or problems with transportation. And if we aren't meeting those people where they live, it's a very good chance that they don't seek medical care at all. A typical patient at our small community might be somebody that's elderly, that has heart disease, that has emphysema. They're on multiple medications, they don't get around well, they don't have family nearby. And for that person to go an hour down the road for their regular routine visits is, if not impossible, very, very difficult. Major barriers to quality healthcare in a rural setting is twofold. It's people and it's money. It's recruitment and it's reimbursement. Oftentimes, the insurance payers and the government payers don't pay us enough money to even keep our doors open or cover our costs. Recent cuts to Medicaid or other programs really isn't helping at all. People, recruitment, getting qualified health personnel in our area to live and work here is also a definite challenge.
Established in 1902 and located in Iowa Falls, Hanson Family Hospital is a municipally owned critical access hospital, meeting the unique needs of Hardin County and our surrounding communities. Across our hospital and 3 conveniently located family care clinics, we offer a full spectrum of services, from wellness and preventive care to acute treatment, emergency and surgical services, specialty care, and more for individuals of all ages and backgrounds.
We take pride in knowing that our community members, our patients, really trust the care we're providing. I think it's easy to see that when you look back over the history, we have generous donors that contributed to the start of the hospital in 1902, which just carry forward. And so there's always been that level of support in the community that it's important to have local care. Our community members deserve that. We carry that forward every day. That compassionate care, high quality first and always is what we do. And I think that all started even back in 1902. Having local access to care makes all the difference. Having to get out in the weather and drive an hour away, they'd rather not have to make that trip. The big advantage, I think, in small town hospitals like ours, we create those connections, those moments of trust that, no, I want to go there because they can take care of me. Don't have to travel 2 hours away. It makes a big difference.
Hanson Family Hospital serves as a lifeline for the community we serve and live in. Our innovative mindset, experienced care team, and vast service offerings support patients through every stage of life. This allows for the continuity of care during different stages of the health journey and a level of familiarity and comfort between our patients and care team.
Having health care close to home is so very important to all of our citizens. From well child checks to wellness exams to having your grandpa checked out for all of his medical problems. If we didn't have something very close to home, these people wouldn't get their care. They wouldn't have access to the quality of therapies and testing that we can provide here.
I feel more comfortable living in a rural community knowing that we have a strong healthcare system that makes me feel more confident as a mom that I have the resources I need to monitor my kids at home. You know, if I have questions, I can call, and so many people will reach out any time of day or night to make sure that I feel comfortable. I don't know that I would feel as comfortable living in a small town if I didn't have access to providers that I had complete confidence in.
Here's the difference it makes. When you live in a small town, we need to have people feel secure here. I get calls from people saying, I need something at the hospital. What do you think I ought to do? This hospital provides so many services for a small town. A friend not very long ago had a seizure, and I said, we need to call the ambulance. And the ambulance guys came. They were wonderful. And now she says, that was one of the best experiences I've had. So those are the kind of things that I feel like we need to build in a small town.
In the future, we would like to continue to add specialty services. Very critical to have those essential services locally. When we think about pulmonology, endocrinology, those are things that we continue to look at. Telehealth is important in the sense that, patient, they can't get into a service. Maybe that service is available 5 hours away. It's another opportunity to extend access to care. And so it's a way of just leveraging that technology as we go forward to expand some of those services.
This town is my home. I was born here. My family lives here. My mom still lives here. My father died here. This is a community that I love with all my heart. And to be able to give back, to be able to see these people every day, to help them, it just brings joy to my heart.
Small town care doesn't mean sacrificing quality or compassion. Whether it's to stay well or get well, we are your health partner for life. Learn more today about Hanson Family Hospital, your home for healthcare in Hardin County. For more information, visit hansonfamilyhospital.com or call 641-648-7000.